Hi, I'm Alice Hart-Davis and welcome to Tweak of the Week. And this week's tweakment is a chin and jaw augmentation. We're in Harley Street. Come along in and let's see how it goes. I'm here in Harley Street with Dr. Pradnya Apte, who is an expert facial aesthetics practitioner and who is going to do a chin and jaw augmentation for us. Not on me, on somebody else. But you have a dental background, don't you? And I feel that must impact the way you look at facial aesthetics.
I think as dentists, because we have an understanding of the facial anatomy and of course how the skeleton actually is of the face, in terms of where the jaws where they sit in position, I think we see faces from a three-dimensional view rather than just injecting points, thinking you ought to fill here and here.
Sure, so it's not just a question of adding filler on the points of the jaw or the whatever, you've got to take a much more nuanced approach to it.
Absolutely, and during any consultation I actually look in the patient's mouth.
Do you? Okay.
Look at the position of the teeth.
Can't help yourself, I'm sure. And if they need something doing to their teeth before you work on them, will you send them off to have that done?
Absolutely.
Okay.
Yeah, it's really important that once you've finished off doing the facial aesthetics, it finishes off with everything nice.
So it will start with the dental work and then you'll finesse.
Yes, absolutely. For example, some people may have what people call buck teeth, where their upper teeth are sticking more forward. And that's the reason for that is because the position of the jaws, the upper jaw, what they call the maxilla, and the mandible, they're not in proportion. We can improve the profile of the patient and we can correct a lot of dental anomalies through the use of non-surgical techniques.
Effie, you have bravely volunteered to be our patient for this today. What's made you step up for this chin and jaw augmentation?
So I've always been conscious of my jawline because my bottom jaw is quite set back and is not in proportion with the rest of my face, I feel personally anyway. And having spoken to dentists before, they've always said the only option really before was to have it broken, realigned, which is a major surgery and it's not something that I really want to go through.
So what are you hoping that this is going to do?
So sort of basically make my bottom jaw in proportion with the rest of my face really, and sort of more defined. Just to sort of give me back a bit more confidence really.
So what I'm hoping to achieve by injecting filler into this part is to give an increased projection to bring it forward. When we can't just have a chin that sticks out, we need a jawline that kind of goes with it, gives a sharper definition. We're just going to put an injection just deep down onto the bone. Why? Gives it nice structural support. But you've got to be careful how much you put in. Female skulls, where they are, and it's all about what they call the gonial angle. And men tend to be more what they call obtuse, women are more acute. So by putting a little bit here, I always like to call it a bit of glue. So it kind of glues everything down and kind of pull back.
But it keeps that angle and stops it looking masculine.
Got to be careful.
The product you were using is Subskin. This is Perfecta Subskin.
It's got what I would call high lifting capacity and in aesthetic terms high G prime. It's more used for structural support.
That's lovely. I mean, you've got that definition.
Can't feel anything.
Okay.
That's obviously because the muscle was.
Yeah.
It just feels a bit tight. It doesn't feel.
Because the cannula is such a strange feeling, isn't it? It's like a burrowing
you can't
thing.
it go like that as it sort of pulls out.
So aftercare, really, I always say to patients, no alcohol the day you've had filler, only because it increases swelling, affects your clotting mechanisms, no sitting in the sun, no sauna, steam room, Turkish baths, and that's it pretty much. It takes up to a month to see the best result. And I always like to see my patients just a couple of weeks later, but I always follow up with a phone call.
I haven't been timing, but that's like half an hour or something, isn't it? Yeah. Brilliant.